Hello, dear learners. I once again welcome you all to this MOOC on population and society. In this week, we are discussing the different variables or determinants of population size. In the previous module and the video, we have discussed about the concept of fertility, various factors determining fertility, and why fertility rate is gradually declining, especially in the developed countries. We know that besides fertility, there are two other important determinants of population size. Those are mortality and migration. Just like fertility, changing rates of mortality and migration also results in the changes in the size of population of a particular society. In this video, we shall be learning in details about the second important determinant of population size, that is mortality. So dear learners, the main objectives of this module are to explain the meaning of the concept mortality and its various types, to enable the learners to understand the causes behind mortality, to enable the learners to know about the various differentials of mortality, and lastly, they will also understand why mortality rate is decreasing in the modern society. Apart from this, the module also intends to briefly discuss about the current status and trends of mortality rates across the globe and especially in the Indian context. So dear learners, let us begin our discussion today with the meaning of the term mortality. In simple words, mortality implies the incident of death of an individual. It is the law of nature that everybody must die one day. Nobody can live forever. So this end of life or death of an individual is what is termed as mortality. According to the World Health Organization, mortality is the permanent disappearance of all evidence of life at any time after birth. From this definition, it is clear that any death prior to a live birth is not considered as death. Dear learners, you all would remember that we have learned about the concept of live birth in the previous module. It indicates the presence of life or signs of living in a newborn. Therefore, any deaths that happen prior to the process of delivery is not considered as death but as fetal death. As such, stillbirths or death of fetus during pregnancy are categorized as fetal death and not as death. So dear learners, you all must have understood what is mortality. It indicates death of a person any time after he or she is born. Now, based on the time period of death, there are different classifications of mortality. The first is child mortality, which implies the death of a child. This child mortality, this category also has different subcategories within it. The first is neonatal mortality. Neonatal mortality is that mortality where a life born before completing 4 weeks or 28 days of life. When offspring dies before completing 28 days of his or her life, it is termed as neonatal mortality. Now, the death of an offspring within 7 days of his or her birth is referred to as early neonatal death, and between 7 to 28 days is referred to as late neonatal death. There are different causes of neonatal deaths such as preterm birth complications, trauma, infection in the newborn, pneumonia, diarrhea, so on and so forth. The World Health Organization has opined that children who die within the first 28 days of birth suffer from conditions and diseases associated with the lack of quality care at or immediately after birth and in the first days of life. Further, according to WHO, the first month of life is the most vulnerable period for child survival, with 2.4 million newborns dying in 2020. So we can understand that neonatal mortality rate is very high, and neonatal mortality rate is the death of a newborn within 28 days of his life, and it is because mostly due to lack of medical facilities or immediate health facilities during those days of birth that such incidents occur. Now coming to the next category, it is infant mortality. The death of a newborn within 1 year of life is called infant mortality. That is, the child dies before reaching 1 year of age. WHO states that there is a global decline in the rate of infant mortality. In the 1990s, the estimated rate of infant mortality was 65 deaths per 1,000 live births, and in 2018, it has decreased to 29 deaths per 1,000 live births. This is indeed a good sign, but the figures of infant mortality is still very huge. In the year 2018, according to the WHO statistics, 4 million infants died within the first year of life, and this figure comprises of 75% of all under 5 deaths. Now, after infant mortality, the next category is under 5 mortality, when a child dies before 5 years of age, and it is termed as under 5 mortality. So we have seen that there are various classifications of child mortality. Now we often hear about another type of mortality called maternal mortality. Let us now try to understand what is it. Maternal mortality is the death of a woman while she is pregnant or within 42 days of termination of pregnancy, irrespective of the duration and site of pregnancy, from any causes related to or aggravated by pregnancy or its management, but not from accidental or incidental causes. The figure of maternal mortality is very high globally, but more so in the context of middle and lower income countries. According to WHO, in the year 2020, about 287,000 women died during and following pregnancy and childbirth. WHO also states that 95% of all maternal deaths occurred in low and middle income countries in 2020, and most of these could have been prevented. Most women die as a result of complications during and following pregnancy and childbirth. Most of these complications develop during pregnancy. WHO states that care by skilled health professionals before, during, and after childbirth can save the lives of women and newborns. Therefore, it is utmost important that all births are attended by skilled health professionals, as timely management and treatment can prevent a lot of complications arising out of delivery and prevent the death of the mother or maternal mortality. In addition, access to quality health care, education and income, affordable sexual and reproductive health services are other important factors which can reduce maternal deaths. So, dear learners, we have learned about the different classifications of mortality. If we go back to history, we will find that mortality rates were very high in the past and was one of the strongest determinant of population size. In other words, mortality rate played the dominant role in determining the changes in population size. Back then, mortality rates were higher because life was mostly dependent upon the whims of nature. The medical services and facilities were inadequate. There was scarcity of food and nutrition. There was prevalence of epidemics, famines, wars, and so on. Harsh living conditions accompanied by lack of advanced medical facilities often resulted in early death, and thus the size of total death or total number of death were comparatively higher. But gradually, with the advancement of human civilization, there has been radical transformation in the field of science and technology, advancement in medical science, improved agricultural production which reduced the shortage of food and nutrition, improved transport and communication system which helped one to immediately access healthcare facilities during emergency, decline in wars and epidemics, improved living conditions, reduced exposure to natural calamities, and all of these together led to the gradual decline of mortality rates over the period of time. Advancement of medical facilities and access to healthcare facilities have played a pivotal role in this regard. In the recent times, we all saw how the COVID-19 pandemic caused a health hazard across the globe, leading to escalation in the death rates. But thanks to medical sciences, that the situation had been brought under control, and with vaccinations and medications, lot of more deaths could be prevented. Had this kind of pandemic occurred in the early stages of human civilization, the situation would have been much more acute, much more worse, and it would have wiped out a much larger size of the population. So we have understood that mortality rate is declining globally, and we shall discuss the causes behind this in details in the later part of this video. But before going to that, let us now try to understand the sex and the age pattern of mortality. Now, what do you mean by the sex and the age pattern of mortality? Dear learners, mortality rate varies from region to region depending on a number of factors like access to health care facilities and health behavior, so on and so forth. Mortality rate also varies across sex and age. Studies have revealed that for most countries in the world, life expectancy at birth is higher for women than men. That is, women tend to live longer than men, and men die at an earlier age than women. However, this is mostly applicable in the case of developed countries, where there is wider gap in life expectancy between men and women. In the lower income countries, the gap is not as much wide. Nevertheless, in most of the countries of the world, the crude death rate and the age-specific death rates are higher for men. Different scholars have pointed to the difference in social roles, lifestyle habits of men and women, their resistance capacity, etc. as the causes behind shorter life expectancy and earlier death of men compared to women. So we have learned that mortality rates vary across sexes. Now coming to the age factor, studies have again revealed that death rate varies with age. It is higher at two particular extremes of life. The first is at the age of 0, that is, before reaching 1 year of age, a newborn death tends to be very high. This is true across the globe. Similarly, death rate again increases after 50 to 55 years of life and rises with the increasing age of a person. So the infancy stage and the old age are two periods in life when death rate is higher. After achieving 1 year of age, death rate declines from the age 1 to 4 and further decreases up to the age of 10 to 14. Studies have suggested that death rate across all countries is lowest in the age group between 10 to 14. After 14, the values of age-specific death rates gradually increase up to the age of 50-55 and then rise steeply at the higher ages. So dear learners, we hope that you have understood how death rate varies across sex and age. Let us now try to understand the other differentials in mortality. As previously mentioned, death rates vary from region to region. Even within the same country, death rates differ from one state to another. Geographical conditions, socio-economic status, educational attainment, sex and age of marriage, etc. are some factors which contribute to the differentials or variations in death or mortality rates. So let us try to understand the first differential, that is rural-urban differential in death rate. Some studies reveal that prior to the 20th century, mortality rates were higher for the urban areas of many countries of Europe and North America, and the differences were quite substantial. Perhaps overcrowded urban areas with lack of proper housing, hygiene and sanitation were reasons behind this. In India, studies have suggested that mortality rate is lesser for urban areas than rural areas. In this context, absence of healthcare institutions, lack of access to affordable and quality healthcare, orthodox health practices, lack of awareness about health and scientific health behavior are some of the reasons behind high mortality in rural areas. So, we have understood that mortality rate varies from region to region and also varies from urban to rural areas. The next differential is income, occupational and educational differentials. Education and income are two important elements which largely determines individual's life conditions and choices, which in turn has a strong bearing upon his health and well-being. For people with higher income, mortality rates tend to be lower because they can afford medical treatments no matter how costly it is. Because of their economic affluence, they can avail the best medical facilities and treatments and therefore have higher chances of health recoveries and survival. Further, they can avail timely health checkups to monitor their health status. Moreover, their income helps them to have a healthy and nutritious diet, which is a prime requisite for good health and longevity. All this results in an increase in longevity and lesser number of early deaths among high-income groups. Secondly, the type of occupation also determines health and longevity of an individual. Individuals engaged in hazardous working environments have the greater risk of being exposed to diseases and are prone to ill health. For example, workers in the coal mines are more likely to suffer from tuberculosis and lung cancer, and those in sedentary occupations face the risk of heart diseases. Again, those occupations where there is high mental stress, hectic work schedule, these too can also negatively impact the health of an individual, thereby resulting in different health issues. So we have learned that risky occupations result in bad health or ill health and more deaths, and thus occupation also determines to a large extent the health of an individual. Educational attainment also has a strong determining role especially in the case of maternal and child, particularly infant mortality. Studies suggest that women with higher education and awareness have better health-seeking behavior and better health conditions. She is less susceptible to orthodox beliefs and health practices, and rather has knowledge regarding health, hygiene, utility of modern medicine, importance of scientific medical treatments, so on and so forth. Thus, she has higher chances of a long and a healthy life, which is not so for an uneducated, illiterate, and an unaware woman. Similarly, infant death is also higher for illiterate mothers. So we have learned how income, occupation, and education determines mortality rates. Now, dear learners, marital status also has relation to mortality rates. Studies have suggested that mortality rate is lower for married males and females than for the unmarried ones of same sex and age. Married men and women tend to feel more secure and protected. They can look after each other, and all these leads to better health conditions and lower mortality rates among them. So, dear learners, from this discussion, we have learned that there are different factors which leads to differences in mortality rates. Let us now try to understand the overall mortality situation across the globe and in the context of India. According to the World Health Organization estimate, there has been a global increase in life expectancy. It has increased by more than 6 years between 2000 and the year 2019, from 66.8 in 2000 to 73.4 years in 2019. While healthy life expectancy has also increased by 8% from 58.3 in 2000 to 63.7 in 2019. This indicates that people now have a long life compared to earlier times, and thus mortality rate is declining. However, infant and mortality rate is still higher, especially in the poor income countries. Now, coming to the Indian context, life expectancy at birth has also improved in the case of India. It has improved by 8.68 years from 62.1 years in 2000 to 70.8 years in 2019. This indicates higher longevity and lower mortality rate in the Indian context. According to the UNICEF data, in India, under 5 mortality rate is 31 deaths per 1,000 live births. Infant mortality rate is 25 deaths per 1,000 live births. Neonatal mortality rate is 19 deaths per 1,000 live births. According to UNICEF data, the under 5 mortality in India is slightly higher for female than male. And according to the World Health Organization, the top 10 reasons for female deaths in India are heart disease, diarrheal disease, chronic obstructive pulmonary disease, stroke, neonatal conditions, lower respiratory infections, TB, diabetes mellitus, falls, and asthma. And the top 10 reasons behind male death are heart disease, pulmonary disease, stroke, tuberculosis, diarrheal disease, neonatal conditions, liver cirrhosis, lower respiratory tract infections, road injury, and diabetes mellitus. So, though most of the diseases are common, yet there exist differences on the type of disease behind male and female deaths in India. So, dear learners, we have got an overview regarding the global and Indian life expectancy and mortality rates. We have also learned about the different diseases and causes which leads to most male and female deaths in India. Now, we have previously discussed that like fertility, mortality too is affected by a number of factors. These factors may be in the form of biological, physical, environmental, so on and so forth. We have also discussed that in the past, mortality rates were usually high during the times of famines, epidemics, wars, etc. But in the present times, due to rapid advancement in medical sciences, rising health consciousness, greater access to healthcare, etc., mortality rate has declined to a large extent. Let us discuss these causes in details. Advancement in medical sciences. Rapid advancement in medical sciences have led to a significant decline in mortality rates across the globe. Medical science have become successful in finding panacea for dreadful diseases. Due to the development of sophisticated medical technology, those deadly diseases which were once considered to be fatal has now become curable. Therefore, due to the availability of better medical treatments, mortality rates have declined to a large extent. Disease control mechanism is another factor behind declining death rates. Most of the countries today have achieved great control over pandemics like typhoid, malaria, smallpox, plague, etc. The recent COVID pandemic also testifies how advancements in medical sciences have helped in finding out medications and vaccines to fight COVID-19 virus, thereby saving thousands of lives and bringing the situation under control. Disease control mechanisms play a great role in declining fertility. Improved medical facilities is also another reason behind a declining fertility rate. Improved medical facilities, particularly in the developed and developing countries, have resulted in declining mortality rate to a great extent. These countries have invested a great deal of financial resources in increasing the number of medical colleges, training of doctors and nurses, so on and so forth. Besides, governments have also taken up a lot of effort in building hospitals with modern facilities in rural areas, and the mushrooming of private hospitals and nursing homes in urban areas have helped greatly in reducing mortality rates. Spread of education is another important reason behind the decreasing mortality rate. The mortality rates are declining in proportion to increasing literacy rate. Expansion of education has significantly helped in spreading health consciousness and awareness among people. People are now aware of the negative consequences of superstition and other beliefs on human health. Education has made people realize the need of visiting doctors, availing medical treatments for resolving their health issues. People have also become aware about the importance of regular physical exercise, balanced diet and nutrition, yoga and meditation, etc. for maintaining a good life, good health. All these trends have helped tremendously in lowering death rates in the contemporary period. Lastly, status of women also has contributed to the declining rate of mortality. Today, the literacy rate among women is increasing in most of the developing countries, which has ultimately resulted in the rise in the status of women. Now, women are more concerned about hygiene, cleanliness, issues of childbirth, etc. They are also similarly concerned about the health of their children, thus significantly contributing towards the reduction in infant mortality and maternal mortality rates. Similarly, the death rate of women at the time of delivery is gradually decreasing due to prevention of early marriages, increasing hospital deliveries, availing modern medical treatments, etc. Lastly, in the present scenario, factors like economic growth, along with increase in per capita income, enhanced medical, health, sanitation, water facilities, etc., has helped in the improving life expectancy rate in the most of the developing countries. We have previously discussed this. It has also led to the decline in death rate, subsequently resulting in increasing the percentage of people living beyond the age of 60 years. In conclusion, it can be said that famines and food shortages, epidemics, Frequent wars and poor housing and sanitary conditions were causes behind high mortality rates in the past. However, with the advancement of medical sciences, rising health consciousness among people, and greater accessibility to healthcare facilities, mortality rates have immensely declined in the contemporary period. This decline in the mortality rate also contributes to the increasing size of population in countries like India, where there is high fertility and low mortality, which results in higher population growth. So, dear learners, from this discussion we have understood the different causes behind declining rate of mortality in the contemporary period. Now let us try to understand why the study of mortality and mortality rate is important. The study of mortality and mortality rate is important to understand the demographic conditions of a region and how it is influenced by the larger socio-economic and other factors. We can understand the larger condition of the society by analyzing the mortality rates. It is also important to examine the prevailing conditions of public health system of a region or a country. Studies on mortality and mortality rates also help policymakers and other organizations in implementing need-specific and problem-specific public health programs. So because of all these reasons, it is very important to study about mortality and varying mortality rates. So with this, we have come to the end of today's discussion. We have learned about mortality, its different types, the differentials in mortality, and the causes of decline in mortality rate in today's video. We have also learned that life expectancy of people have increased and mortality rate is declining worldwide, even though it varies from region to region. There are various sources from which we can gather information and data on mortality rates of different regions, such as the civil registration system, national census, demographic sample surveys, etc., which we will discuss in details in the next week in module 6 and 7. Similarly, we have been talking about mortality rate all throughout this video. We have explained what is mortality, but there are various ways to measure mortality rates. We shall learn about them in details in module number 10. So dear learners, we end here today. Thank you for listening to us and we hope to see you in the next video. Thank you.